Thank you AICOG for giving me opportunity to share my views. These are some of my credentials, and I would request all the researchers to become a member of ORCID so you can have your work published worldwide. The moment child is born, mother is also born. She is existing, mother is something new. With the blessings of mother of mine and so many mother, 3 books written by me is recommended as a reading material in AICOG. 2 books have gone for second edition and editor-in-chief of 2 journals. We all know that fertility is subfertile, and we all know that in developing countries more than 20% women are having infertility. In current age of delayed marriage, late menarche, child spacing, career-oriented, have got more and more infertility, and we have to advise them to go for fertile window to have a good population and good ovulation and good fertility. So maximizing fertility depends upon the accurately gauging the ovulation, appreciating the time of fertile window 5 days prior to and the day of ovulation. However, so many women don't know about the myth of conception, that menstruation, the timing of fertile window, everything is not up to the mark. And with basal body temperature and hormonal kit, we can have them assess when they are living in a remote area. So what we have got apprehensive person in this ultrasound, luteinizing hormone, the person who are not staying at far, they have got no facility of ultrasound. LH kit is available easily on Amazon and everywhere, so they can go for LH search, LH detection, and then go for timely intercourse. Serum, progesterone, and urinary pregnandiol, we can have a ultrasound monitoring, BBT and cervical mucus loss, their affinity. All the ovulation monitoring is common in practice, and we know that Steptic and Petro, they are doing abdominal monitoring of the ultrasound for folliculometry, taking laparoscopic pickup and doing IVF. We have to thank the person who has introduced transvaginal ultrasound for monitoring of the ovulation and picking up of the ovum. It makes very easy for ART practice and your work. We have to explain particularly very good regarding the fertile window. The fertile window is approximately 3 to 5 days before ovulation and continuous point approximately 1 to 2 days post ovulation. So identifying that window and simplifying the ovulation, and we can advise our patient to get maximum fertility. And we know this is a very good paper by Wilcox in 1999, that even though there are very good pregnancy, but in naturally occurring pregnancy, 189 women has got abortion because of it is not implanted on a proper window frame. So this is the window frame in which if we have got fertilization or ovum is implanted by maximum implantation point into the endometrium, there and there the pregnancy will continue. So many times in practice we can see that pregnancy test is positive, one line is pink and one line is fair, and next month, next week we can say that she has got period. So that is a chemical pregnancy. So utmost important of identifying the fertile window for which they will get the maximum benefit. Transvaginal ultrasound has defined ovulation particular time. How we can say? There is decrease in the size of follicle, sometimes collapse of the follicle, there is increased echogenicity inside the follicle, we can see pouch of Douglas free fluid and triple line endometrium with the homogeneous endometrium gauze, and there is a very good ground glass epidermis of the endometrium that we call as a progestronization of the endometrium or pregnancy conducive endometrium. If this type of endometrium is there, and when ovum is released from the ovary, resting in the garden of Vancouver to make the 300 or 3 million sperm, 300 million sperm to get it fertilized, just like 3 idiots, and they are implanting into the endometrium. We are implanting ourselves intrinsically into the endometrium. We all know this is the different category of ovulation monitoring. This is enteral follicle count, when dominants become follicle, and when there is a rupture of follicle, we can see the free fluid. Dr. Nagori is sitting in the crowd and he has taught us the perifollicular flow. 50% perifollicular flow vascularity is indicative of good chances of conception. When peak systolic velocity more than 10 cm per second, there is excellent marker for higher pregnancy rate. Dominant follicle may have a ring of angiogenesis. If ovary having corpus luteum shows high RI, more than 0.50, there will be non-viable conception. RI of non-dominant follicle ovary may be 0.69 to 1. How we get Doppler in our infertility? How color adds in our life? When we have got color Doppler with us, use color Doppler beautifully. Those who are practicing IVF, the concept of looking at the ovary is totally different. When we are not doing IVF, not doing infertility practice, we are just watching ovary right and left. But once we start practicing fertility, the ovaries become the soul. We can visualize the ovary size, antral follicle count, vascularity, number of follicle, how follicle grows. So our concept of looking at the ovary becomes different. Just like love our neighbor. So ovary is our neighbor to the uterus, and we are in the Bible it says thou your neighbor, love your neighbor. So we are loving the ovaries to get the very good flow in the perifollicular flow, and at that time, same time we have to see the endometrial flow. If it is absent, it is zero, pass it's okay and good. This is the different variety of endometrial flow to get the good implantation rate. For perifollicular flow, this is no perifollicular flow. 25% perifollicular flow. 50% perifollicular flow. This is just you have to put your color Doppler at the site of ovary and you can see the ring of angiogenesis. With color Doppler in infertility, 50 to 75% perifollicular flow with good endometrium. At that time, if you do IUI or if you advise couple to get timed intercourse, you will get definitely good pregnancy rate. So 100% perifollicular flow with cumulus furcus in the ovary, it gives very good fertilization rate. And this is simple thing, you can see. This is how you have to see the vascularity in the uterine endometrium. Just you have to reduce your PRF, that is pulse repetitive frequency, at the lowest. And you can see vascularity is going inside the endometrium, and this is very good vascularity you can see. If this type of vascularity there, endometrium is 8, how you can see this measurement is 1 centimeter and this is 0.8. So without measuring the endometrium, you can measure with this 1 centimeter line. At the same time, if you see the ovary, there is a very good vascularity around the follicle, and this is more than 75 to 80% perifollicular flow, so conception rate is very high. So ovulation monitoring, we have to give ovulation inducing drugs. We all know that we have to monitor by transvaginal ultrasound. And if you are measuring estradiol, if it is more than 200 with 18 to 20 millimeter of follicle and 7 to 8 millimeter of endometrium with good perifollicular flow and vascularity, and if you go for timed intercourse or ovulation induction by HCG, you will get very good ovulation monitoring. We all know that these are the different indications for which we are using ovulation inducing drugs. Two giant in market, letrozole and clomiphene, and here I am going to present two papers of mine. This is paper comparing the letrozole 5 mg with clomiphene cited 100 mg. This paper is published in 2021 and everybody has got paper with their hand. This is a 50 patient study of both arms, double blind study, so conceptor also don't know and patient is also not knowing whether they are taking clomiphene or letrozole. And we have done study and we find that letrozole compared to those clomiphene citrate has got very good cumulative pregnancy rate, 72%. American has accepted letrozole as an ovulation inducing drug in 2016. Australia has accepted this is in 2017. So in India now letrozole is emerging a lot, and we can see this is a head-to-head comparison that if we are giving clomiphene citrate, we can get the multifollicular ovulation, peripheral anti-estrogenic effect, thin endometrium, thick cervical mucus, long half-life of 5 to 7 days, high miscarriage rate, high multiple pregnancy rate, high resistance in PCOS and low live birth. But if you are using letrozole, there is a monofollicular ovulation, no anti-estrogenic effect, better endometrial thickness, better cervical mucus coverage, and very short half-life of 45 hours, and improved implantation, lower multiple pregnancy rate. So you can effectively use in CC-resistant PCOS, and there is a high fertility rate. This is second paper. Once we had used letrozole and clomiphene citrate, then we had started using, adding this with human placental extract, that is HPL, and then we get very good result. We know that placental extract is a human placental extract coming from the aqueous extraction biochemically enriched from fresh human placenta. It is available in 2 ml ampoule, which is derived from 0.1 gram of human placenta, and it is used for the treatment of anti-inflammatory property. We all know that HP injection has got specific inflammatory, wound healing, immunomodulatory, melanopoietic and debridement action, and this is very useful particularly in the cases of PID and PCOS. So peptides, nucleotides and amino acid has got fibrin type 3, that will go for debridement. Ubiquinone has got collagenous activity and improves the tensile strength of the healing tissue. Corneotropic releasing factor, we all know that acts as anti-inflammatory. NADPH, when citronine is converted into arginine, there is a release of nitrous oxide, and that nitrous oxide is vasodilator, and that vasodilatation is required at the level of endometrium. PDRN inhibits pro-inflammatory cytokines and stimulate growth factors. Amino acids, glutamate, chemotaxis inducing factor speed up the healing process. So here we are given 2 ml injection, 10 injection, alternate day in both the arm with letrozole and clomifene citrate, and we get very good result of 76%. So here I want to say that the giant which is there in market, that is clomifene 100 mg, letrozole 5 mg is not inferior to the clomifene citrate 100 mg, and we can use it judiciously. And cumulative pregnancy rate is 29 in clomifene citrate and 38 in letrozole group. If you see, the number of women who have ovulated is 92% with letrozole. So monitoring of ovulation is a comprehensive. We have to use suitable protocol. Ultrasound is utmost important. We don't forget the AFC and AMH. We have to consider in account. Baseline FSH should be used to counsel the patient. Induction of ovulation with IVF protocol, we have to monitor. Ultrasound monitoring is utmost important, and ultrasound made our job very easy. We can measure estradiol, we can measure the monitoring of the luteal phase. If you know corpus luteum is very good, we can supplement with whatsoever progesterone drug we have got faith in, and we can have a pregnancy test after 15 days. So monitoring of ovulation is very good with ultrasound monitoring. This is my last slide. Everybody has got some problem in their life. Okay, so do you have problem in life? No, then don't worry. If you have got problem, can you do something? No, then don't worry. And if you do it something, then also don't worry. So life is very happy. Please have an audio, please.
To be happy is now, and the place to be happy is here. And the way to be happy is to make someone happy and have a little light here.
So at the end, our patients will be happy. We should have a good ovulation monitoring the ultrasound.
The time to be happy is now, and the place to be happy is here. And the way to be happy is to make someone happy and have a little light here.
Thank you very much for patient listening. Thanks Lot Aicog for giving me opportunity to share my views. Thank you very much.
You take questions in the beginning.